Hello and welcome to my YouTube channel. In today's video, I will be talking about necrosis. So let's start the session. What is necrosis? Necrosis is a type of cell death which occurs in response to injuries such as hypoxia, extremes of temperature, toxins, physical trauma, or infection. It is always a pathological process. Why I am emphasizing this? Because when I taught you about apoptosis, I told you that apoptosis could be both because of physiological and pathological causes. However, necrosis is always a pathological process. So what happens in necrosis? In necrosis, there is denaturation of the cellular protein and enzymatic digestion of the cell. You all know that the cell has both structural and functional protein. So, when there is denaturation of these proteins, there will be cellular distortion and there will be injury to the cell. Also, there is leakage of cellular contents through damaged membranes. So, remember here in necrosis, the cell membrane is damaged, and because of the damage to the cellular membrane, there is leakage of the cellular content. Also, there will be, because of leakage of contents, there will be inflammation. So remember, in necrosis, it's always a pathological process. There is denaturation of cellular protein and enzymatic digestion of the cell. There is leakage of cellular contents through the damaged membranes, and there is presence of local inflammation. Here in this image, I have tried to emphasize on the pathophysiology of necrosis. So as you could note, because of hypoxia and ischemia or radiation or other injurious agents, there is damage to the mitochondria and the cellular membrane. And when mitochondria is damaged, there will be decreased production of ATP, which will lead to decrease in the energy dependent functions of the cell. Also, because of increase in reactive oxygen species, there is damage to lipids, proteins and nucleic acids, which will further contribute to the cell injury and cause necrosis. Also, the cellular membranes are damaged. There is damage to the lysosomal membranes, which would lead to leakage of enzymes, and there is damage to plasma membrane, which would lead to leakage of cellular contents, and this further will contribute to necrosis. So always remember, in necrosis there is damage to both mitochondria and the cellular membranes, and that will lead to decrease energy dependent functions, damage to lipid, proteins, nucleic acids, damage to the lysosomal membranes, damage to the plasma membrane, and all this will contribute to necrosis. In this slide, I have shown you three very important characteristic features of necrosis, which are pycnosis, karyolexis, and karyolysis. Let me talk about pycnosis. What is pycnosis? Pycnosis is the shrinkage of the nucleus. When the DNA condenses into a shrunken basophilic mass, it is known as pycnosis. And what is karyolexis? Then in karyolexis, there is nuclear fragmentation. The pycnotic nuclei membrane ruptures and nucleus undergo fragmentation. So you can see here in this image, there are fragmentation of the nuclei. Okay. So this phenomenon is known as karyolexis. And what is karyolysis? Karyolysis, the chromatin undergoes dissolution due to action of DNAs and RNAs, and there is nuclear fading, and this phenomenon is known as karyolysis. So, pycnosis, karyolexis and karyolysis are three characteristic nuclear features seen in necrosis. Let's talk about the types of necrosis. So, what are the types of necrosis? Well, there are five main types of necrosis: coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Coagulative necrosis. Well, this is the most common type of necrosis. It occurs mainly because of ischemia or infarction. And what is the characteristic feature in this type of necrosis? In coagulative necrosis, the architecture of dead tissue remains preserved. Remember this, the architecture remains preserved. There is nuclear and cytoplasmic details are lost. So what will happen? There will be loss of nuclear and cytoplasmic details, but the architecture will remain preserved. So as I have told you, the architecture of the dead tissue remains preserved, and this phenomenon here will give rise to ghost cell or cells which have tombstone appearance. As you can note here, the figure of tombstone. In the tombstone figure, you can see there is only a outline. Okay, here you can just note the outline of the cell. Okay, this is the tombstone, and you can see in tombstone there is only the outline of the tombstone, and there is no features visible inside the tombstone. So the cell will also appear like this only when it is when it undergoes coagulative necrosis. The outline of the cell is maintained, but there will be no nucleus features and there will be no cytoplasmic details which could be seen. So in coagulative necrosis there is tombstone appearance. And where does this where will you find the coagulative necrosis? Well, coagulative necrosis occurs in most of the body organs. However, the exception being brain. Remember this point. There is coagulative necrosis in all organs of body except brain. And what type of necrosis do you see in brain? You see liquefactive necrosis in brain, which I will be telling you in the next slide. So what are the examples of coagulative necrosis? Coming to the example of coagulative necrosis. One example is acute tubular necrosis, which is seen in kidney. Another example, very common example, is seen in the histopathology picture of acute myocardial infarction. So as you can see in this image, I have shown you the gross appearance of a spleen infarct. And you can note here the yellow wedge-shaped infarcts. So these are the foci of coagulative necrosis. The yellow wedge-shaped infarct depicts the coagulative necrosis which has happened here in the spleen. In this micrograph, you can see an H&E section of the kidney, where here you can see the glomerulus and here there are tubules, and here you can see some other tubules. Appreciate the difference between this side and this side. As you can see in this micrograph, one side you can see there is presence of architectural details, while in the infarct side there is loss of the architectural details. As you can see, I have put a thin arrow here which is showing the infarct side of the kidney, wherein you can appreciate there is loss of nuclear and cytoplasmic details. However, the architecture is maintained, and this appearance is also known as tombstone appearance or ghost cell appearance. Coming to liquefactive necrosis. Liquefactive necrosis is also known as coagulative necrosis. In this type of necrosis, there is transformation of the necrosed tissue into a liquid gel-like mass. So how will the necrosed tissue look in liquefactive necrosis? It will look like a gel-like mass. That is why the word liquefactive necrosis, because it will look like a liquid. Often it is associated with bacterial and fungal infections, and it can also be seen in cases of internal chemical burns. In liquefactive necrosis, the affected cell is completely digested by the hydrolytic enzymes, resulting in soft circumscribed lesion containing pus or fluid remains of the necrotic tissue. And after the removal of the cell debris by the white blood cells, as I have told you that the necrosis is invariably accompanied by inflammation, there will be a fluid filled space left, which is generally associated with abscess formation. So where can you see liquefactive necrosis? Liquefactive necrosis is seen in brain abscess. This is the gross picture of brain, and you can see here I have shown liquefactive necrosis, which is characterized by liquefied gel-like material within a cyst wall. And now coming to the micrograph of brain. Here you can see the H&E picture of brain infarct, where you can notice pale areas of liquefactive necrosis with loose sheets of foamy macrophages and edematous fluid. So note here there is loss of nuclear and cytoplasmic details, and the architecture is also lost. So always remember, in liquefactive necrosis there will be loss of architecture as well as nuclear and cytoplasmic details. Coming to caseous necrosis. Well, caseous necrosis is a unique form of cell death in which the necrosed tissue has cheese-like appearance. This is a type of coagulative necrosis only, but the necrosed tissue has a cheese-like appearance, and that is how this name has come, caseous necrosis. Caseous means cheese-like. So in caseous necrosis, there is cheese-like appearance of the necrotic tissue. So what will you see in the histopathology? You will see structureless collection of fragmented or live cells and amorphous granular debris which is enclosed within a distinctive inflammatory border, and this collection is also known as granuloma. I will show you the granuloma in the next slide. So in what conditions you see caseous necrosis? You can see caseous necrosis in tuberculosis, syphilis, histoplasmosis and coccidiomycosis. Now this is a picture showing lung, and you can note here cheese-like appearance. You can note the cheese-like appearance here, and this cheese-like appearance is the foci of caseous necrosis. So this is a tubercular foci in the lung which is showing caseous necrosis which has cheese-like appearance. Remember that. So this is a micrograph of tubercular foci, and in this tubercular foci you can note here there are presence of epithelioid macrophages, there is presence of these giant cells, and there is presence of caseous necrosis. So in caseous necrosis you can see all this amorphous granular debris, there is amorphous non-nuclear granular debris, and also there is presence of giant cells and epithelioid cells on the periphery. This type of inflammation is also known as granulomatous inflammation. So basically I'm showing you here that in caseous necrosis there is loss of both nuclear and cytoplasmic details, and the architecture is also lost, and in cases of tuberculosis or sarcoidosis it is accompanied by granulomatous inflammation. What do you understand by granulomatous inflammation? Granulomatous inflammation is a type of chronic inflammation which is characterized by caseous necrosis surrounded by epithelioid macrophages, giant cells and a cuff of lymphocytes. We will talk about granuloma formation in the session when we will be talking about chronic inflammation and covering the granulomatous inflammation. Coming to fat necrosis. What is fat necrosis? You know, in our body there are certain regions where there is a lot of adipocytes. There are certain fat rich locations in our body, and what are those locations? It could be female breast, or in cases of pancreas, or in the mesentery. These are fat rich locations. So when necrosis happens in these locations, it is fat necrosis. And how does the fat necrosis happens? It is because of release of lipases and its action on adipocytes. What will that do? The lipases are when released causes formation of fatty acids from triglycerides, and these fatty acids combine with calcium to form soaps which appear as white chalky deposits. I will be showing you the gross appearance of fat necrosis in the next slide. And where can you find fat necrosis? As I've already told you, fat necrosis will always be seen in those organs which are fat rich. So in cases of traumatic breast injury or acute pancreatitis, you can encounter fat necrosis. So here in this picture you can see the chalky white deposits which are because of fat necrosis, and in this you can see the micrograph showing fat necrosis. Here you can appreciate the intact adipocytes. These are the intact adipocytes, and here what you can see, here what you are seeing is all fat necrosis, and it is giving a cloudy appearance. Coming to another type of necrosis is fibrinoid necrosis. In fibrinoid necrosis, the basic pathology is deposition of antigen antibody complexes in the wall of blood vessels along with fibrin. And where do you note fibrinoid necrosis? It is mainly seen in vasculitis or in when you encounter rheumatoid nodules. There you can see fibrinoid necrosis. How does fibrinoid necrosis look? Well, in this micrograph you can see this is a vessel. This large vessel you can see, this is a large vessel, and here in this large vessel you can see this amorphous eosinophilic ribbon-like pink material. This is all fibrinoid necrosis. So always remember, the fibrinoid necrosis will always be brightly eosinophilic ribbon-like, and mainly it is seen in vessel walls. So I have told you about all types of necrosis. Let me summarize this for you. So I have made this table, and in the table I have told you about main features and causes of various types of necrosis. So as you can see here, there are types. The types of necrosis are coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. The main features of coagulative necrosis is that the architecture is maintained, but there is loss of nuclear and cytoplasmic detail. Again, I will emphasize, in coagulative necrosis, the architecture is always maintained, but there is loss of nucleus and cytoplasmic details. And this appearance is also known as tombstone appearance, or these cells can also be called ghost cells. And where do you see coagulative necrosis? It is mainly seen in ischemia of all organs except brain. Yes, all organs, but not in brain. Another type of necrosis I have told you was liquefactive necrosis. The main feature in liquefactive necrosis is that here the architecture is also lost. So remember, in coagulative necrosis the architecture was maintained, but in liquefactive necrosis there is loss of architecture along with loss of nuclear and cytoplasmic details. And what will the necrosed tissue look like? It will look like a gel-like mass. So where do you see liquefactive necrosis? Mainly in cases of when there is ischemia to brain abscess, or some kind of other pyogenic infections, you will find liquefactive necrosis. Coming to caseous necrosis. In caseous necrosis also there is loss of architecture and there is cheese-like appearance. Remember this, it's a very important point. Will be cheese-like appearance grossly. And what are the causes of caseous necrosis? It could be because of tuberculosis, syphilis, histoplasmosis, or coccidiomycosis. Fat necrosis. As I have already told you that fat necrosis is seen in fat-rich locations, which could be breast or pancreas or mesentery. And fat necrosis, there will be cloudy appearance of the adipocytes. They will lose their architecture and they will form a cloudy appearance. The adipocytes will show cloudy appearance. So fat necrosis is seen in cases of breast trauma or acute pancreatitis. Fibrinoid necrosis. The fibrinoid necrosis, as I have told you, is mainly seen in cases of vasculitis, and in vasculitis you can see brightly eosinophilic ribbon-like or fibrin-like appearance in the vessel wall. So fibrinoid necrosis is seen in vasculitis and there is brightly eosinophilic pink ribbon-like appearance or fibrin-like appearance. So coming to the end of this session, as I have told you that necrosis is always pathological. This is a very important feature. Necrosis is always pathological. So because of enzymatic digestion of the cell and because of decreased ATP, there are changes, morphological changes in the cell, and the first change is there is swelling of the cells and the organelles. So first, as you can see here, there is swelling of the cell and organelles. Then there will be loss of membrane integrity. After that, there will be leakage of the cell content and there will be nuclear degeneration. And three features I have told you about the nucleus is pycnosis, karyorrhexis and karyolysis. And as I have told you that it is always invariably accompanied by inflammation. You can see the inflammatory cells here. So necrosis is always pathological and necrosis will always be accompanied by inflammation. Just a quick recap for you people. As I have told you, necrosis is actually a type of cell death which is always pathological and is caused by denaturation of structural and functional proteins, that is enzymatic digestion of the cell. It is always pathological. There are 5 types of necrosis: coagulative necrosis, liquefactive necrosis, fat necrosis, fibrinoid necrosis and caseous necrosis. In coagulative necrosis, there will be loss of nuclear and cytoplasmic details, but the architecture is always maintained. However, in liquefactive necrosis, there is loss of architecture also along with loss of nuclear and cytoplasmic details, and there is formation of a gel-like mass. In caseous necrosis, there is cheese-like appearance and it is mainly seen in tuberculosis. In fat necrosis is noted mainly in fat-rich locations which are female breast, mesentery or pancreas, and is seen mainly in acute pancreatitis or whenever there is a trauma to the breast. And fat necrosis, you can appreciate cloudy appearance of the adipocyte. Fibrinoid necrosis is seen mainly in vasculitis, and there you will note within the vessel wall brightly pink eosinophilic ribbon-like material deposited in the media of the vessel wall. So basically, I have covered all my points of necrosis, and I believe that you people have understood this session very well. Please go back and read your books. Come again and see this video, and I am very sure that you will understand all aspects of necrosis very nicely. Necrosis is a very important topic for exam, and invariably the questions are asked about necrosis in both your university exams or where you are prepared, or whether you are preparing for your PG exam. So I hope you have understood the concept of necrosis and types of necrosis and their salient features very well by now. I'll see you in the next video. Bye bye for now.